Hi, Grandma. I heard that you had questions on acute respiratory infections, specifically on pneumonia, since you've had it before. And first of all, I would like to explain what acute respiratory infections are. And acute respiratory infections are the leading cause of infectious disease in the U.S., and they have killed over 3 million people a year. And acute respiratory infections can be divided in two types. The first one is the upper respiratory tract infection, and the second is the lower respiratory tract infection. And here's a picture that I got from the book of my professor. Upper respiratory tract infections include the nasal cavity, the pharynx, and the larynx. And the lower respiratory infection, that's when it gets um, worse, uh, is the trachea, the primary bronchi, and the lungs. So I would like to use my dog as an example of upper respiratory tract infections right here. He's a pug, and whenever it gets cold or allergy season is up, he's very prone to upper respiratory tract infections because of his skull, that he's brachycephalic. He doesn't have a very large snout, so bacteria comes in and he's very prone to um, getting sick. So I don't know if you can hear him snoring, um, but that's how pugs sound, and they're known for getting sick a lot and upper respiratory tract infections. And now back to this. What happens when you have an upper respiratory tract infection? There's a cross section here of what happens to the trachea, and this is a close-up of a normal trachea and a inflamed trachea. So you have here that it's not narrow, it's not constricted or anything, so the person is able to breathe. But on the opposite side right here, the smooth muscle is inflamed, and then the yellow part right here is the mucus accumulating with the bacteria of the infection. So that is what makes it hard to breathe, because the trachea narrows, so people have a really hard time breathing. And another example of that would be in the bronchi, which is right here. This is a normal bronchi, and this is a inflamed bronchi, hence the bronchitis. Itis is inflammation. Remember that. Anything that ends in itis is inflammation, Grandma. So you see here that nothing is constricted. Smooth muscle is not inflamed and it's fine, as opposed to this picture that smooth muscle is constricted. There's accumulation of mucus, which probably has the bacteria, and making it hard for the person to breathe. So you might ask, well, how do I prevent this? What can you do? So the World Health Organization has asked for people, like for children, breastfeeding for the first 6 months, and then after that, proper nutrition. And here's a mother breastfeeding her child. After the 6 months of breastfeeding, they can do proper nutrition, such as fruits, vegetables, a lot of vitamin C, anything to prevent low birth weight. And then for adults, it goes across the board for all diseases. Hand washing is very important. In the job that I have right now at Driscoll, they told us of a trick of washing our hands and singing happy birthday twice, and that would guarantee that your hands are clean. So proper hand washing is a very good technique to prevent the spread of the infection as well. And then also to reduce air pollution, prevent being in areas where you know that people are smoking, like in closed areas. Also, areas prevent having plants, the silk plants that accumulate dust, or rugs that accumulate dust. Also, that can trigger uh, your pneumonia to be uh, getting worse. So, how would you diagnose, or how would you know if you have pneumonia? So, a lot of people in developing countries, they use the stethoscope, like in this picture and in the next picture right here. They try to listen to a crackling, bubbling sound or rumbling when they ask the person to breathe. And also, they check for the kids to see how much they breathe in. So I believe if it's less than 40 breaths a minute, it that calls for a diagnosis of pneumonia. And also for lab work, they order a CBC to check the white blood cell count. If it's a high, it usually indicates that there's an infection. And also to really determine if you have pneumonia, they usually ask for a CT scan, or more than likely a chest X-ray. And this is what a chest X-ray looks like of a person with pneumonia. So you see here the chest cavity, the black part is where the lungs are, and it should be all of it black, but right here in the red circle you see white, and that's where fluid accumulated due to the pneumonia. And now you want to know what treatment you can have for pneumonia. Well, first of all, go to your doctor. That's the best um, thing I can tell you. Go to your doctor. He would probably give you an antibiotic for the next 5 days, and send you back home to rest. And to soothe your throat and cough, I would say like a tea with honey and lemon, like you used to make for us when we were younger, when we get sick. That's a good remedy for that. And then follow up with the doctor the next 2 days. So I hope I was able to answer most of the questions you had or doubts you had about pneumonia. And please let me know if you have any questions next week, Grandma. Thank you.